Dr. François-Pierre Gladu is the Vice President of Montreal Family Doctors Association. And Dr. Gladu, first of all, thank you for taking the time to call us this afternoon. We're looking very much forward to talking to you. How are you today?
Very good.
Great.
And you?
Very well, thank you. It's always nice when you can tell a doctor that you're doing well. It hurts when I do this, doctor. Anyway, let's get serious here for a minute. The negotiations between the family physicians and the province have broken down today. And basically what the physicians are saying is it's because the government is refusing to budge on Bill 2. What, can you shed a little more light on that?
Well, if you remember correctly, last week the Prime Minister called our negotiator to Quebec and basically said to him, if we can have a collective bargaining agreement instead of Law 2, it'd be perfect for everybody. And so we went back to the negotiating table in good faith. We thought that negotiation would replace Bill 2, and with still the same objectives of having more access and more quality. But the reality of it was that we didn't feel there was any mandate at the negotiating table to go that way. So, and we confirmed this morning when the government just went out of the negotiating table.
So it was the government negotiators who walked away from the table?
Yes.
Okay. Now, what can you tell me about? It seems to be very confusing, this whole issue around compensation, around doctors not being able to decide where and how they practice medicine. Why do you think anything is going to change in the near future? Do you think GMFs are suddenly going to be reopening? Well,
there are two answers to that. Bill 2 is part of the problem, and then there's the GMF program itself, which is as bad as Bill 2, actually. So we have to understand that Quebec is very distinct in other things besides language. Doctors here, they can't go practice anywhere without the government saying so. They can't open an office without being obligated to do hospital work as well. So we already have many constraints since the last 20 years. And that's part of the problem why some of our young doctors don't even begin to practice here. They just go elsewhere at first after their studies. Now with Bill 2, it's another layer on the cake, if you will. More constraints. Compensation is cut by 75%. And so obviously all the clinics won't be able to be viable. And so that's why you see every morning, this or that clinic is closing or how many doctors are leaving. I think the Collège des Médecins du Québec has received 635 demands for their certificate of good professional conduct. And that's a step towards going elsewhere in other provinces. So really, and that was from like 2 weeks ago, so it's probably worse now. So people are unfortunately, they're looking at their options B, their plan Bs.
And what's going to happen to families who can't afford to go private and are now just left without a family doctor? Are they just basically left to the whims of the CLSCs and the clinics and that sort of thing?
Yeah, it seems like the government is like on another planet right now. Bill 2 says actually that every Quebecer has a family doctor. Now, you understand that it's completely opposite to the reality of what we're seeing, and that instead of having more doctors to work in family practice clinics, we have actually less since the last 2 months since Bill 2 was adopted. So I can't give you an answer on that. We're not sure where the government is going with this. It's actually very sad because every other province is investing in primary care because they know that primary care lowers the level of expenses in hospitals and medication, and people's diseases are taking more earlier, and so we have less expenses globally on the health budget. But it seems that our province does not understand this.
You make perfect sense there. You go to see a family doctor because you have, a cut or something like that, and the doctor will say, well, that looks like it's going to get infected. Let's fix it now. And instead of just leaving it and then ending up in an emergency room with a badly infected situation. Doctor, you've painted kind of a grim picture here. Do you see any light at the end of the tunnel? Is there any way to this being resolved?
Well, since the last few months, family doctors have asked for an arbitrator to try to settle the dispute. We weren't sure if the government was negotiating in good faith, and now we have our answer. So an arbitrator would actually be a reasonable solution. The government argues some things like doctors are paid too much or they're not working hard enough. And from our side, we're saying, well, you're obligating doctors to go work in an hospital, which other provinces aren't doing. So that's why there are less doctors in clinics. And if we're paid so much, why are our doctors going to Ontario and New Brunswick? So in other words, we're not even agreeing on the diagnosis. And an arbitrator would be able to look coldly at the situation and see the cold facts and settle the dispute to the advantage of patients, and so that we can get out of this crisis and salvage our family care offices now.
Doctor, I'm sorry. Go ahead. What were you about to say?
And I was just saying that many thousands of people have asked the government that. There's a National Assembly petition right now to abrogate Law 2, Bill 2, and to ask for an arbitrator. I think La Presse had 60,000 readers asking just for that as well. So, and the patients groups have asked for that. The experts from the ministry have asked for that. So we're not really understanding what government fears about, settling this with an arbitrator.
Well, it makes perfect sense, and for a layperson like myself looking in from the outside, it absolutely makes perfect sense to have someone who doesn't have, as they say, skin in the game to figure out what the best way forward is. Dr. Gladu, I really appreciate you taking the time to talk to us about this today, and sincerely, I wish you the absolute best of luck. I hope this gets resolved and resolved quickly.
Yeah, thank you. And we're mostly thinking of patients now because we're not sure where this is going.
No kidding. Thank you.
Yeah.
All right, Dr. Gladu, again, thank you for joining us. We really appreciate your time this afternoon.
Thank you.
Unmistakably Canadian.
It's the music that raised you.
The artists raising the bar.
Hi, this is Brian Adams.
Hey, my name's Brett Emmons. I'm from the Glorious Sons.
Hi, I'm Nelly Furtado.
Made in Canada. The station that champions Canadian music.
Loud, proud, and all yours.
No passports required. Just press play.
Tap into Made in Canada now on iHeartRadio.ca
or the free iHeartRadio app.